Assalamu alaikum ji, my name is Dr. Aamir Mehmood. I am graduate from King Edward Medical University, and after completing my Masters in Health Management, I have been working as a healthcare consultant, currently employed as a CEO of a multinational healthcare technology company. I would like to thank today Talks. They invited me over to explain to general public about the role of IT in healthcare in Pakistan and abroad, and also what is a paperless information system. So a little word about my experience. I've been working in healthcare for the last 30 years. And I've not only worked in the healthcare technology sector, but I have worked in different disciplines, different facets of healthcare in Pakistan, in private and public sector, as well as internationally, where I completed a number of projects successfully and rolled out for the sake of benefits which were utilized by the public, the end users, and the organizations. So what is the role of IT in healthcare, and what is actually the paperless information system? Now, if you look into the role of IT, I would like to take a few minutes of your time to look into the role of IT in terms of what's happening around us. There was a time that we used to have a black and white television, and it transformed into a color television. From color television, a plasma television came in, and then came an LCD, then LED, then I don't know what else. So things have been evolving around IT, and that's the beauty of information technology. Now, what is information technology? In order to understand that, I think we should understand that it's a subset of a word called ICT, which is Information Communication Technology. Now, the word to disseminate information across different levels, I think communication becomes a vehicle. The information is parsed and sent to different areas through different channels, and the channels are adopted just to communicate and facilitate the end user to understand. When was the first information system developed, and what is actually an information system? Information जिस तरह उर्दू में हम कहते हैं कि जी मालूमात, और सिस्टम क्या है? सिस्टम एक निज़ाम का नाम है. But when it comes to in terms of technology, information doesn't become just malumat. It becomes the data that is required to collect, to process, to analyze, to retrieve, to distribute, and finally to display. Lot of different grading of that word information is now being done. Similarly, what is a system? System is basically defined for the boundaries, for the departments, for the sub-departments, the infrastructure, the way it is connecting, the facilitation that it is taking the information across board, across different levels, seamless flow of information, that is a system. Now, within the information system, once this data is basically processed within the system and is distributed across the board, that becomes an information system for any place. Now, healthcare is no different. In a hospital, we all have somehow, one way or the other, been to a hospital. We know that we go to the reception, we get a booking done, we select a doctor. From the doctor, we go to the nurse for triage. After triage to the nurse to the junior doctor, we end up seeing the doctor. The doctor sees us, prescribes some medication, advises some test, and then that thing goes on to the lab, to radiology, and then to pharmacy, and from pharmacy to invoicing, to billing, and then the back departments also start working. So you see, there is a very cumbersome process throughout the life cycle of a patient journey within the hospital. Whether it's an outpatient, whether it's an inpatient, whether it's an ER patient. You cannot expect the patient or the relatives to pick up all these slips, invoices, and that was simplified by having, from a computerized information system, they started having a seamless automated information system. Now, what further strengthened was way back in 1996, during Clinton administration in US, a bill was passed for an act called HIPAA, which is Health Insurance Portability Accountability Act. Now, what it safeguarded was that data patient confidentiality was to be maintained, and also they are different people changing jobs at different time. Their insurance or their health protection should continue to go on. The Privacy Act, the Security Act and the Breach Notification Act, all three were enacted upon within this act, and a law was passed. Now, what did it mean to the general public? It meant that all the doctors or clinics or hospitals that were functioning at that time in US were to transform their business from manual processes to a system process. Now, in system, what happened was that everything had to be digitalized, everything had to be organized, everything had to be accessible, everything had to be very streamlined, and ultimately the transformation would take place. So the process started in '96, and by year 2020, according to the data by the CDC, around 95% of the hospitals and clinics within the US were automated, and all were basically covering a digital footprint of the patient. And there was the data was protected and people could access the data from anywhere in the world. Now this gives a great latitude and great freedom for the patient to take advice, to take consult, to move forward, and for all the other payers and providers to actually act for the benefits of the patient. For example, once you have the data of critically ill patients, what you do is you create reports and validate it according to the set benchmarks of treatment of patients. Now, based on that, during Obama regime, Obamacare came in, and they actually gave the insurance company the latitude to call for the free checkups or the annual checkups of the patient who are higher risk, so to reduce the hospitalization. Now, what are the benefits that you could have achieved from having these records manual? No benefits, because the data would be so much to collate. Data was scattered all over the place. But when it was transferred into the digital world, it became very easy to get the reports out, to manipulate in a way that we could benefit out of it, the patient could benefit out of it, and so forth. The life moves on in a very good manner. The other thing that comes to mind is that we are looking into the automation by itself. The automation is a seamless activity that promotes actually seamless activity, so that we are not limited, we are not for a moment being restricted at any cost. So the automation, what are the benchmarks for automation? The automation is that your processes have to be digitalized. The processes have to be in a manner that those repetitive, redundant processes are not to be repeated. The things are meticulously being going on through the system support. The system is secured. The system gives timely information. The accessibility can be from physically from within the premises, outside the premises, in the cloud, anywhere you want, but it is still secured. It is integrated. Now, the word integration, you have gone to labs for getting your results done, and by the end of the day or within 6 hours, you get your reports online on your phone. Now, this is integration of those devices to your record, your demographic record that was added into the lab, and the information that you get is part of the medical record that is being maintained elsewhere. So you see, this integration becomes so beneficial for the patient that you cannot miss out on all the information that is basically going on in your life about your health and so forth. The reliability of the information is based on real time, and finally, it's the streamlining of all the processes. What we are advocating is that automation is the key to seamless, paperless transformation of all the products that is around you, that will help you go forward. Now, I've seen that we've spoken a little about Pakistan, that in a lot of different provinces, mostly in the private sector, and also the government has taken the initiative to use information systems. This is basically to capture the real-time information, because data, whether it's census that you need to do, whether it's critical disease, whether it's something else, you need that. So I think government initiatives are there. The private hospitals everywhere, the big names, they are using information systems. US, I've already spoken about, almost about 97% of the population have taken the initiative to be transformed to the digital footprint. One of the biggest organization which has been giving free medical coverage in UK, which is NHS, has also now reverted to changing everything onto the digital side from the manual, because they had very extensive manual documents to transfer. They have done it. I have hands-on experience on the transformation that happened on that is still going on in UAE. It's almost every big clinic and hospital is transferred digitally, connected to the insurances. Kingdom of Saudi Arabia, that currently I've been associated with for last 8 years, is also now have a 2030 vision of transformation of all the patient records and connecting all the hospitals, 284 hospitals and over 2,400 clinics they're connected to each other, so the patient can actually go anywhere. Now, see the benefits out of it. The patient record is always accessible. It does not mean that people are going to lose jobs. In Pakistan, people continue to fear that the computer has come, the automation has come, and we're going to lose the job. No, it's going to give you an opportunity to increase your skill and be employed elsewhere. Elsewhere means not out of your job, but it is not necessarily you standing out in front of thousands of people screaming on your head, rather than you sitting at the back end maintaining the process. I can tell you, I've managed one of the biggest projects that happens on the earth, which is the Hajj period, and I've done it for the last 6 years. And from the time that we automated the entire process, from capturing the data from the barcode which was appended on the wrists of the Hajis, and to the entire process of dispensing medication through the barcodes, the QR codes and all that, we saw that a huge amount of people standing at one reception counter reduced to just trickling. It was not that we were experiencing lesser outcome of the people, it was simply that the information technology helped us. Now, I've tried to remove the technical jargon and share with you what simply you can understand as a layman on what is the role of information system, how important it is, and what are the benefits that we can reap out of it. It's not the end of my discussion. Maybe we will talk again, but for now, I will leave you with the thought that the transformation first step is streamlining your business process. Thank you so much.